first speaker is Governor Tom Wolf.
So thank you, Sarah. And I just want to say thank you, Senator Haywood, Senator Almond, Representative Kozarowski, and Representative O'Neill. Thank you all for being here. Really appreciate it. As I think you all know, this is we make up the task force in terms of figuring out how we can continue to do a better job of getting the vaccine out. And I got to say, we've had, from my point of view, very good and very constructive meetings, and I just appreciate your willingness to be part of this process. So thank you very much. And thank you all for joining us. I'm proud to be here again with all the members of the COVID-19 Joint Task Force to announce a new milestone, and that is that on Saturday, February 27th, Johnson & Johnson had their COVID-19 vaccine get emergency authorization from the FDA. Johnson & Johnson, as you all know, is the third vaccine that has been approved, but what's different about the vaccine is that it is a one-dose, not a two-dose vaccine. And I think I speak for everybody when I say that we're really proud and happy that this has happened. Pennsylvania expects to receive about actually 94,000 doses directly, the Commonwealth, and then the federal partnership, actually the federal partnership is going to do another, I think, 30,000 doses to pharmacies. So in all, it's really over 124,000 doses of the Johnson & Johnson vaccine that we'll be getting in the very first week. We'll be getting more in weeks to come, and we look forward to hope more of this coming between now and the end of March. Again, as I said, unlike the other vaccines, Johnson & Johnson is a one-dose vaccine. It also has less stringent storage requirements, so the logistics are going to be a lot easier. This is going to allow for greater flexibility during the distribution and the administration. So in consultation with the Department of Health, Pennsylvania Department of Health, and the Pennsylvania Department of Education, the task force, we have all decided to recommend that this Johnson & Johnson stream go to our teachers and school employees, public and private. That's everybody, teachers, bus drivers, staff, cafeteria staff, janitors, management, so that we can get our children back to in-person classrooms as quickly as possible. With Johnson & Johnson as a one-dose vaccine, this actually is an advantage in that we can do this more quickly than we can with a two-dose vaccine. Again, our goal is to offer every public and private school worker a vaccine. We want to keep staff and students safer in schools, and we want to help get students back into the classroom faster than by doing it this way than any other way that we could conceive. Vaccinating teachers and staff is an important step to getting students back into the classroom safely. As we all know, the youngest learners and vulnerable students, including students with disabilities, as English as a second language, are going to benefit most from in-person learning. And to get those students back into the classrooms as swiftly and safely as possible, we are prioritizing teachers and staff who work with pre-K and elementary students, students with disabilities, students with English as a second language, teachers of English as a second language, and teachers of other vulnerable students in the first round of vaccines. Getting the youngest and the most vulnerable back into the classrooms will also help parents, many of whom have been struggling to balance jobs with child care, learning support duties, and all the other things that goes along with parenting young kids for far too long. We're also working through the retail pharmacy partnership to ensure all early childhood education workers have access to the vaccine, including child care workers providing an essential service to working families all across the Commonwealth. Future allocations of Johnson & Johnson vaccine will focus on teachers and staff who work with older students. The doses of this vaccine will continue to be allocated to teachers and school employees, public and private, until every educator has the opportunity to be vaccinated. Because we're dedicating all of the supply from a newly approved vaccine to this effort, our vaccine rollout to the rest of the population will be unaffected. In fact, those in line for Moderna and Pfizer will see an increase in supply of these vaccines because Moderna and Pfizer have also This last week was great, not just because we have a new vaccine, but also because Moderna and Pfizer doses, those vaccines, those will see an increase in this week. Everyone who's already eligible under Phase 1A of the COVID vaccine distribution plan will remain eligible and will continue to distribute Pfizer and Moderna vaccines as swiftly and efficiently as possible. But getting students back into classrooms is a priority for our COVID task force. We all know that in-person education is absolutely important for students. And we all want to give our students the tools they need to succeed. We need them to get those tools. A high-quality education puts students on a path to future success, and a strong education system enriches our communities and enriches our economy. We know that the educational losses that students have experienced over the past year are severe. And schools provide key support services for students in communities beyond the classroom. So it's not just the learning gap that has occurred over the past year. There are opportunities for behavioral support programs. We've missed out on that. And access to nutritional meals. We've missed out on that. So schools are also where a lot of social and emotional growth takes place for our children. When our students can't see their friends, that's hard. But we need to make sure that when students and teachers get back to the classrooms, they're safe. Our job is to make sure students can focus on learning and growing rather than on worrying about their safety. So I want to thank all the members of the task force for your hard work. Together we're making progress, I think, to help our youngest and our most vulnerable students get back to the classroom safely. I also want to recognize the efforts of staff in my administration and the Pennsylvania's intermediate units. They've worked tirelessly since the approval of the Johnson & Johnson plan to make this a reality. I know the president yesterday announced that the teachers, he wanted to make teachers a priority. We actually did this at our meeting on Sunday. So we appreciate the president thinking that we made the right decision on this. This is a critical step, and we're glad to have the resources to help students get back into the classroom and keep our communities safer. However, just let me point out, we have to remember that COVID is still here, and vaccinations are only part of the strategy. Many schools have already started to get students and teachers back into the classrooms using safety measures like mask wearing and social distancing. Vaccinations are just one more layer of a protection on top of all that to help the process continue. And it's important that we continue to wear masks, that we continue to practice social distancing at schools and wherever possible. Even after teachers and school employees have been vaccinated, these things will remain important. Schools are an integral part of our communities, and all of us are proud to stand with teachers and families and students to make our schools and our communities safer. This initiative will help protect our communities. It's going to take burdens off our parents and families, and it's going to make our schools get back to the business of teaching our kids, which is exactly the way it should be. So now, I thank you for that. I'm going to turn this over to State Senator Art Haywood. Senator.
So first of all, I want to thank Governor Wolf for his leadership in all of these matters, having tremendous decisions to make throughout this pandemic, which started for many of us about 1 year ago. Fortunately, we are now at a point much closer to what we might consider seeing light at the end of the tunnel. And I cannot thank the members of the task force enough for the constructive comments, for the full engagement, and as well as those members of the Wolf administration who are providing guidance to this task force. I'd like to share that this task force has made some critical decisions and considerations already, looking at the provider network and how we can strengthen it, making sure the individual gets second doses when there were some concerns about second doses. And now today announcing that we're going to make sure that those who are educated from pre-K through 12 are vaccinated, at least have the opportunity to do so. Now, this pre-K element is as critical as K to 12. There are those individuals who are providing the care that allow many, many individuals to go to work. Now, we know we are still deep in this process making adjustments as they need to be made. As Governor Wolf said, we are actively trying to improve the rollout of the vaccine. Of course, we need vaccine that can be rolled out. And we're so glad that the Biden administration appears to be making that happen. Beyond the educators, I do want to share that we are looking at making sure that our efforts are equitable. Today, the department rolled out the Your Turn tool in German, Chinese, and Spanish, so we can be as accessible as possible. Again, I want to thank all of those who are on the task force, and I want to thank each person who has contacted me or my office with concerns about what we should do and how we can do it better. We are glad to receive those concerns and are committed to continuing to make improvements in this rollout. Having shared that, I would now like to introduce my good friend Ryan Ahmed, who you will notice is wearing a mask similar to mine. But it's not only that. His office is right next to mine in the Capitol. Ryan.
Good morning. It is a privilege to be here with my colleagues in the task force and the governor. It's terrific to see you all in person. We've been spending a lot of time together virtually over the last 2.5 weeks, including, as the governor mentioned, a very important conversation on Sunday afternoon. Today represents a major step forward in our effort to combat COVID-19 and restore and rebuild a stronger Pennsylvania. We have a very unique opportunity over the next few weeks to get our children back in school, get parents back to work, help Pennsylvania families, strengthen our communities, and further position our economy for recovery and growth. Additionally, and significantly, we are addressing the challenges our seniors have experienced with obtaining the vaccine through a revised distribution plan and focusing a growing supply of Moderna and Pfizer vaccine on our seniors and others in Phase 1A, and doing so within the existing provider network. While we believe this change will have a significant impact, this task force is committed to continuing our efforts to distribute those doses in a more efficient and effective manner. The actions this task force and Governor Wolf have taken, with 94,000 doses of Johnson & Johnson vaccine and the revised distribution plan, will positively impact millions of Pennsylvanians all across this Commonwealth. In closing, I want to thank the Governor, Acting Secretary Beam, for establishing this task force, taking the step to establish this task force, the opportunity to offer feedback, shape policy, and make decisions, as has been discussed already, and do so in real time, has thus far exceeded my expectations. At the outset, I urged bipartisan collaboration. I urged engaging the private sector and other stakeholders. The Governor and the Acting Secretary have acted on all of those suggestions and more. We recognize that much work remains, but I'm confident that we are turning the corner and dramatically improving the process to ensure any Pennsylvanian who wishes to be vaccinated has access to vaccine. It's now my pleasure to turn the podium over to my colleague on the task force, Representative Kowalski.
Good morning. My name is Bridget Kowalski. I'm representative of the 114th Legislative District in Lackawanna County. I would first like to thank Governor Wolf, Acting Secretary Beam, Director Padfield, and my Senate and House colleagues that make up our joint task force. Each one of us has put politics aside to collaborate and find ways to protect the health of all Pennsylvanians. Today's announcement that is recommended by our joint task force is a special initiative that is a step in the right direction. by allocating the Johnson & Johnson vaccine to our educators, contracted staff, and child care workers. We are providing a way to prioritize the health and safety of both our teachers and our students while paving a path to get our children back into the classrooms. 2 weeks ago, as a task force, took the initiative to limit the impact of those first doses in order to secure second doses that would coincide with Operation Warp Speed's calendar. It is critical that we stand here today and make it very clear to all Pennsylvanians that your second dose of Moderna and Pfizer vaccines are secured and will be allocated within the CDC recommended guidelines. At the end of the day, we are faced with the task of coming up with a plan to allocate a vaccine supply that simply did not meet the demand. We as a state, we have the infrastructure, we have the incredibly talented providers, and the selfless volunteers to get this vaccine into the arms of Pennsylvanians. But all of that is limited if there is no physical vaccine to allocate. By taking the steps we took, Pennsylvania's first dose supply is now on its way to meeting the demand. As a registered nurse for over 26 years, I trust the scientists who are creating and manufacturing these life-saving vaccines. I am grateful to every willing provider across the Commonwealth whose mission is to vaccinate our communities and keep all of us safe. We have heard it time and time again. It's going to get better, and this plan, in effect, is truly going to help do that. Thank you very much. And it is with my pleasure, I'm going to introduce now my colleague, Representative Tim O'Neill.
Thank you, and I'm honored to be here today. So I honestly think since the pandemic began, this is the first time that a bipartisan group of legislators, as well as the governor, have stood together to address the problem. And quite literally, this is what our citizens expect, and it's certainly what they deserve, for us to be working together to find solutions instead of fighting and accomplishing nothing. So I'm honored to be here today to participate in that with all of you. Certainly, vaccinating our teachers and reopening our schools is something that everybody wants. It's not a Democrat issue, it's not a Republican issue, it's a Pennsylvania issue. And I have seen firsthand with my own children, Lucy and Daniel, the academic and emotional effect this pandemic has had over the course of the last year. They want to be in school face-to-face with their teacher and peers, and they ought to be. That's what today is about, ensuring that we can get our children back in the classroom by vaccinating the teachers while also continuing to prioritize and protect the senior citizens across the Commonwealth. In addition to that, I was the author of House Bill 326, where I've been advocating to get our National Guard involved in the Commonwealth's vaccine efforts. This effort will also take the first step of getting them involved as well. As a former member of the Pennsylvania National Guard, I've seen the capabilities our military has to deploy millions of dollars worth of equipment and thousands of people across the world in a timely and efficient manner. Our Guard is the perfect group to run this mission of vaccinating our teachers so schools can reopen. In closing, I just want to thank my fellow task force members. We have worked in a strong bipartisan and collaborative approach, as the others have said, and that has got us to this point here today. I look forward to our continued work together so that everyone who wants a vaccine will be able to get one in as fast and efficient manner as possible. Thank you very much, and I'd like to turn it back over to Governor Wolf.
Thank you, everybody. Nice job. Great. So I'll do the questions. If any of you want to say anything, you hear the questions you want to say. Okay, Sarah, back to you.
Thanks, Governor. Thanks to all of our speakers, too. We're going to open up the questions now from our reporters. We ask that if you have a question, you raise your hand, as I see many of you have already done. We will call on you, invite you to unmute. If you could please, I'll say your name and your media outlet, but if you could please say who your question is for before you pose the question, and then you are certainly permitted a follow-up question. So our first reporter today is Aaron Martin from WPXI. Go ahead, Aaron. You should be able to unmute.
Hi, Governor. Thank you for taking the time. This question is for Governor Wolf. I wanted to start by asking a little bit about how some of the logistics of this process will go. I saw in the release that just came out the National Guard will be involved, that this will be done through the 28 different intermediate sites, intermediate units throughout the state.
Right.
So is this going to be a situation where teachers are contacted by the state in order to come get the shot? Do they have to contact the state themselves? How will this work?
The intermediate units are, and by the way, they have a connection with both the public and the private sector schools, and they will be reaching out to them. The National Guard will be managing the security and the logistics aspects of making sure the shots are actually administered into arms. But it's the combination of the National Guard and the intermediate units, and they'll be reaching out to the teachers, the educators, bus drivers, the staff who are in line to get this unique vaccine.
And just one quick follow-up on that point. You mentioned how we're seeing additional doses of Moderna and Pfizer as well. We're, of course, still hearing from people who are waking up hours before a vaccination clinic is announced, struggling to get on, not able to actually get a vaccine. What is your message to people who hear this and say, I've been trying to get a vaccine for 2 months, I'm in 1A and I still can't get one?
Well, that's true. And 1A, back in January or December, when 1A was first established, there was a shortage of vaccines. There were fewer vaccines in supply than there was a demand for it. Each week, I think the supply has increased, and it increased again last week. But it's still not, I think it increased nationally from 14.5 to 15.2 million doses just last week of the Pfizer and Moderna alone. So that was a big increase in just one week. But even with 15.2 million vaccines going to states, the supply simply isn't meeting the demand. So we're doing better, and I think with the task force, we're doing a better job of figuring out how to get that limited supply out. And there are more vaccines available this week than there were last week, but it still doesn't take away from the fact that the supply of vaccines is still not up to where the demand is. And until that happens, even if we were hitting on all cylinders, even if we were doing 100%, which we're not, we're figuring out how we can do better and better. But even if we were doing a perfect job, there still would not be enough vaccine yet to meet the demand. The interesting thing was the president yesterday said that he's hopeful that we can get to the point where every person in the United States who wants to get a vaccine can get one by the end of May. So I think that actually moved, at least in what he said, his timeline up by 2 months, and so that would be a very hopeful sign. But right now we're not there yet.
Thank you.
Is Pennsylvania prepared for that?
I'm sorry?
Is Pennsylvania prepared for that, to get everybody vaccinated by the end of May?
We're working on that. We would love to be in line with that, yeah.
Thank you. Next, we have Barbara Barr from WGAL. Go ahead, Barbara.
Thank you, Governor Wolf and task force members. My question is, until now, you've given control of decision-making to individual school districts as to whether to go in person or virtual learning, depending on the data. Is this a mandate if a certain percentage of teachers and staff are vaccinated?
We're basically saying to teachers, we want you to get back to teaching, and we're going to make this available. And if we've offered it to you, the state can't force the school. The school districts are all independent and they make their own decisions. But the deal as far as the teachers are concerned is that we need them to get back to school. And if you've been offered a vaccine, you ought to be willing to go back to school.
Have you received any assurance from school districts that if a certain percentage of teachers and staff are vaccinated, that they will indeed have in-person learning, since that is the goal?
I can't say that we've received written assurance from the school districts, but we've been working with the teachers, with the school districts, with the intermediate units, and they all seem to be on board. I think I haven't heard anybody who thinks this is not something that we ought to do. So I'm hopeful that this will lead to the result we want. And again, keep in mind, because Johnson & Johnson is a one-dose vaccine, we don't have to wait the 4 weeks or 3 weeks between the first and the second dose, and then 1 to 2 weeks after that to get somebody up to immunity. This should happen after the first vaccine. 1 to 2 weeks later, they should be ready to go. And to the extent we're moving this out immediately, we should have teachers begin to be able to go back to work before the end of this month.
Governor, thank you.
Thank you, Barbara. Next, we have Deanna Durante from NBC 10. Go ahead, Deanna.
Many of the school districts tell us that they still have the spacing concerns and high transmission rates in their individual counties that they have to follow. So will the vaccination of teachers then outweigh those other regulations that they have to follow from a state and from a county level?
Yeah, that's a good question. We have, again, the way we have worked with the schools is to say, here's your surrounding area, and you're either in a low, moderate, or high area in terms of risk. And if you're in a high area, you should be virtual. If you're in a moderate area, the idea is a mix, a hybrid of virtual and in-person. If you're in a low risk, you should be in person. Most school districts are moving, we still have a few in the high-risk area, but the vaccine should make it so that regardless of where you are, you should be able to do whatever those guidelines suggest that you ought to do. And to the extent that those guidelines increasingly suggest that we ought to have at least a hybrid, if not a full back-in-person teaching, the vaccine should give teachers, educators, the confidence that they can, in fact, go back into the classroom.
But this doesn't give the blanket to say, okay, you have the vaccination, get back into the classroom. And how many public, private school teachers, administrators, school bus workers do we have in the state, and when do you anticipate that they will all be vaccinated?
It's a good question. That's a tough one to answer. Again, keep in mind we have 500 school districts, and the school districts are actually in charge. The Department of Education, the way we have done this is to send out guidelines and say these are the guidelines. You ought to be in a low-risk area, you ought to be doing it in person. In a moderate risk hybrid, or a moderate risk hybrid, in a high risk, you ought to be completely virtual. And that has changed. We update that every week. The vaccine should make this easier to do whatever those guidelines suggest, make it easier and gives teachers the confidence that they can be back in person when the situation warrants that. And we're moving toward that. More and more schools are in areas that are in low to moderate risk areas. So there is, in one way or another, the guidelines are that you ought to be able to go back to work. The vaccine should just give educators that last ounce of confidence that they can, in fact, go back into the classroom and be safe.
But again, how long do we expect this to take?
You also asked. We don't know the exact numbers, but the estimate is somewhere around 200,000 people when you take into account all the teachers, the school bus drivers, the aides, the counselors, the school nurses, the administrators, and everybody. It's about 200,000, but we don't know how many of that 200,000 have actually already gotten a vaccine because they're in they have a pre-existing condition, an underlying condition, or they're over 65. So we just don't know. We also don't know how many of that group might say we don't want the vaccine. It's a crude estimate, but again, we have 94,600 vaccines in this first round of Johnson & Johnson. The pharmacy partnership is another 30,000, so that's 124,000 out of that, whatever it is, 200,000. That's a lot of people who are going to be in line as quickly as we can roll this out to get a shot in the next couple weeks. And that means that if it takes 1 to 2 weeks to make sure that the vaccine has taken hold in the body, that we should have the bulk of our educators able to go back to work by the end of the month.
Thank you. Next up, we have Chandy Chapman from WTAE. Go ahead and unmute.
Okay, thank you so much. I had one question. Is there a plan in place to ensure that administrators who may be working in a separate building, not interacting with the children as much, are not going ahead of the educators who are interacting with the kids and getting this vaccine? And another part, you briefly mentioned daycare teachers. Where are they in line in getting the vaccine? Because it starts with preschool. So 2-part question.
Okay, let's see if I can remember both parts. The idea is that this gets rolled out in the early childhood areas, as I mentioned, and some of the high-risk areas first. So administrators are educators, and regardless of where they are, they're in this line. Within the line, I think we're trying to get the youngest, most vulnerable first, the early education areas first, and we'll move up from there. But again, the hope is that we can move really quickly because we have this one-dose vaccine uniquely targeted to this group. It means we can get back to school quicker than we would if we use the two-dose vaccines.
Thank you. Next up, we have Brett Schultes from WITF. Go ahead, Brett.
Oh, thank you very much. And this is a question for Governor Wolf. I am not going to turn my video on.
I have 4 more people here willing to take questions. So, okay, go ahead, Brett. Go ahead.
Well, thank you, Governor. I actually want to slightly change tack because I know members of the bipartisan task force, as well as some on the county level, have really been pushing for the allocation of vaccines to a few mass vaccination sites. And just focusing specifically for a moment on the one at Park City Center, I know they've said there that they plan to open even without an allocation of vaccines next week and use some of Lancaster General Health's vaccine allocations. I just wonder how you feel about and whether you will be pushing for an allocation to Park City Center for next week as part of its launch, or if you aren't able to commit to that yet.
Yeah, I can't commit to that, but I want to get these shots into as many arms as quickly and equitably as possible. So one of the things that we're basically looking at 3 things, the task force, as to how we can do that, and the sort of the general idea is that we're using the retail or the pharmacy network of hundreds of pharmacies all around the Commonwealth. They have the logistics experience and skill, and they have the expertise to actually get the shots into people's arms. So that's one channel. But we're looking at these mass vaccination sites. The National Guard will be very helpful in making sure that works, but also local health authorities. And I think in Lancaster, Lancaster General, the health systems will be very big in this too. So that is one avenue. And then there's going to be a third to make sure that the least accessible populations, the populations who are going to be hardest to reach, that we do take affirmative steps. And we still have to figure out how we're going to do that, but we recognize that there's more ways to get these vaccines out than just the pharmacy partnership. And again, what we're doing here is I think an original, innovative way to try to get shots to a specific targeted audience as quickly as possible through a unique channel that exists in our education system. So we're open to all those things. Again, part of the deal is how we allocate what we get, but the biggest part is how much we get. And we don't, unfortunately, control that. So we will be getting, as I say, the country is getting 15.2 million vaccines that we know of. The pharmacy partnership that the federal government is managing directly is going to be another. We don't know how much there. And then this new Johnson & Johnson channel is, as I say, about 2.8 million vaccines going out across the country in this first week. So that's what we know, and how we allocate that is to try to get to the people who we think are the ones who deserve priority, like the 1A folks, and now teachers and educators. And to the extent we can do that the fastest and most equitable way, that's what we're going to do. Yeah, anybody want to
Thanks so much, and I have no need for a follow-up. And
well, let me see if anybody want to add anything to that? Yeah.
If I could just briefly comment on it, first of all, I'm extremely pleased with the work that's underway in Lancaster County and with the mass vaccination site. The partnership is very unique. The public-private partnership, the private partners that are involved 4 major health systems in the county that have come together to support this mass vaccination site, and of course the support of our state legislative delegation, as well as our county commissioners, local government officials. We think this mass vaccination site has the potential to really drive throughput to get vaccination into arms as quickly as possible to the residents of Lancaster County. As the governor said, it really comes down in many respects to supply. As the supply increases, we think sites like Lancaster County will certainly benefit, in addition to the funding distribution model that we've discussed, allocating vaccine based on a number of factors, based on population over the age of 65, the COVID infection rate, the death rate, and then tying performance, driving throughput, 80% of that first dose within 7 days. Many mass vaccination sites, certainly one in Lancaster, I think will benefit from that plan. But I wanted to just take the moment, Governor, to just thank all of the folks in Lancaster and elsewhere across the Commonwealth, but I'm most familiar with the Park City work. Just thank them for the work that they're doing, and I think, again, we're going to see the vaccination, the doses increase dramatically over the next couple of weeks, and folks in Lancaster County and all across the state are going to benefit from that. And I've certainly raised this particular issue with the task force and the Lancaster County work directly with the Secretary of Health and Governor, and I appreciate their support of it.
I just do want to address the issues of hesitancy. So when we have mass vaccination task locations or even pharmacy locations, we still have some hesitancy in some communities. And these vaccines are effective and safe. And whatever ethnic or racial background that you come from, they are effective and safe. And the choice between vaccination and being one of the 500,000 people who are no longer on the planet, to me, is clear. And I also want to say that in addition to these mass sites, as the governor has said, we've got to look at going to certain communities with mobile sites, clinics in neighborhoods. That's part of our assessment as well. And I did want to say something to one other reporter who said that if we get all the vaccine in May, will we then assure that we would have vaccinated everyone in May? I find it highly unlikely that it all shows up on day 1 and it's all administered on day 2. So I do believe that we've got to look at this from a practical perspective. And that is, if we get all the vaccine by the end of May, it will probably take us through June to get it into all of the arms. Thank you.
Anybody else?
Thank you so much. Next, we have Tyler Pratt from WLVR. Go ahead, Tyler.
Good morning, Governor. Question about the Johnson & Johnson shot, which has a lower efficacy than the 2-dose versions. What would you say to educators that might be concerned they're getting a less powerful shot than other people?
That should not be a concern. I think Bridget, who's a nurse, could be probably address this even more effectively than I. There is a 70% efficacy compared to 95% on the first two. Just by way of comparison, first of all, it's 100% effective in terms of hospitalization. It prevents that 100%, and 100% prevention of death. So there might be a slightly higher risk that you could get some sickness, feel some sickness because of COVID-19, but it's 100% effective from keeping that disease from becoming more serious. And I think, Bridget, you talked about what the normal flu shot efficacy is, just as an example.
Yeah, thank you, Governor. And to repeat what the Governor said, the vaccine is effective, whether it's Moderna, Pfizer, or Johnson & Johnson. The vaccine's main goal is to keep you from getting ill from COVID-19 and to keep you out of our hospitals, out of our ICUs, and off ventilators. Whether you receive either 3 that are offered to you, they are all effective. The testing that has been done, the percentage of effectiveness is different, but it is in the long term, in the long run, it is effective against the COVID-19. The flu vaccine has the same kind of effect. I mean, you don't know exactly the amount of percentage that it may or might not be effective against the strain, but the bottom line is all three are effective, and the main goal is to keep you from getting ill from COVID-19 and to keep you out of our hospitals, intensive care units, and ventilators.
Thank you. And as a follow-up for the governor on this, do districts and schools have the power to mandate that their teachers get vaccinated?
I'm not sure anybody in the Commonwealth has that power. I think what we're saying is if you've been offered the vaccine, you really ought to come back to school and be willing to work in the classroom. And I think that seems to be what teachers organizations that we've talked to are supportive of. I think it's what the educators in the school districts are supportive of. But in terms of actually mandating, I don't think that capacity exists in Pennsylvania, whether you're a public or a private employer.
Thanks for that. Just real quick, do you have any? Would you like to comment on Texas getting rid of the mask policy and your thoughts?
Yeah, my thoughts are, I'm not a doctor. Well, I'm a PhD, so I'm not really a medical doctor. My mother always said I'm not a real doctor. But it seems to me that one of the things we've noticed this year is that the flu season has been incredibly mild. And one of the things that people have pointed to is that more people are wearing masks and practicing social distancing. So I'd be concerned that go too quickly. The CDC said that we've made great progress as a nation in terms of reducing the COVID incidence rate, the hospitalizations, and all that kind of thing. But we're still at unacceptably high levels, and we've seemed to have reached a plateau. So right now, the weather is going to get warm. I'm assured that spring is actually coming in a couple weeks. But I think we need to make sure we're not taking our foot off the gas pedal too soon. And if I were in Texas, I might be a little concerned that this is just a little too soon.
Thank you. Next up, we have Maddie Hanna from the Inquirer. Go ahead, Maddie.
Hi, yes, thank you, Governor. I just have a question about the timing and the numbers to clarify. So when you mentioned 30,000 doses that are going to pharmacies, just to clarify, is that specifically designated for educators as well? And secondly,
so before you get to the second question, let me just make sure, so I don't forget that. The answer is yes.
Okay, great. And then about 200,000 educators and support staff total in the state. So if you've got 94,000 Johnson & Johnson doses coming in through the IUs and then the 30,000 going to pharmacies, what will it take to get the remaining educators and support staff in the state vaccinated? And is there any time frame or when do you anticipate that might be able to happen?
Please keep in mind that these are all very crude estimates. And so when I say 200,000, that's sort of what we're thinking. But if we had the combination of 30,000, and when I say those 30,000 are really focused on the educators in Pennsylvania, that's in Pennsylvania. That's the arrangement we have made here in Pennsylvania. I don't know what other states are doing with their pharmacy partnership allocation, but we are doing that in Pennsylvania. The 94,006 is what we got, and we get to allocate ourselves. So the combination of that is 124,600 doses. If I'm right about the 200,000, and I might be off by tens of thousands here, there is another, between now and the end of March, we should get another, the estimate from the federal government is that between now and the end of March, an additional 4 million Johnson & Johnson doses. I don't think they're coming next week, may not even come the week after that, but between now and the end of March, we'll get another 4 million doses of Johnson & Johnson. If we get the typical allocation of that, we basically got 9,400 and some thousand out of the 2.8 million, so the combination of those two things, we should have enough vaccines to cover the entire education community, private and public, by the end of March. And if you assume it's a one-dose vaccine, if you assume that it takes 2 weeks, actually the effectiveness actually increases each day. I think up to 2 weeks hits the maximum. So let's just say the very latest under that scenario would be that we get the shots out within the first week of April. 2 weeks after that, sort of mid to the third week in April, would be the very last of the educators at all levels who should have gotten the vaccine. But the vaccines will start, in the next couple weeks here in March, so that over 100,000 educators should be ready before the end of March to be back in the classroom. So that I don't mean to be too hazy here, but these are all really crude estimates, and I'm doing the best I can with the numbers. And we really don't know exactly how many vaccines we're going to get, Johnson & Johnson, by the end of the month. But the federal government has been fairly confident that they're going to deliver somewhere around 4 million in the last week. And so far they have been under-promising and over-delivering. So what they have said, they've actually done slightly better than they've promised in the past. So if that happens, then we should be able to. And again, this is the virtue of using the Johnson & Johnson vaccine, because time is of the essence. The faster we get to this point where the injections have been made and the immune system is functioning fully, the sooner we can get our classrooms open and our kids back to school.
Thank you. Do you have a follow-up, Maddie? You're good? Okay. We're going to move on to Lizzie Hardison at Capital Star. Go ahead, Lizzie.
Oh, thank you so much. I think that Maddie's question actually answered, that got to a lot of what I wanted to know, but I guess I'm just curious a little bit more about signups and registries, and just, if you know yet how schools, is it going to be schools that will run the signups and help schools get appointments, and will there be any kind of prioritization? You mentioned that there will be people who are people working with young children or English language learners will be eligible first, but I guess how is that going to be enforced, and is the system going to be kind of similarly patchwork to what's already in place statewide?
No, it's really focused on the educators, and it's being managed by the intermediate units, and they presumably, as I understand it, are really concentrating on making sure that this is very targeted. It's targeted to the folks in the public and the private school systems that they have connections with and relationships with, and they'll be able to know who should be eligible in what order, and they'll be managing this process, again, with the National Guard.
Thank you. Next up, we have Jim Melwart from KYW. Go ahead, Jim.
You actually may have just answered my question there, but I'm curious why you're using intermediate units, and with the convenience that you mentioned of the single doses, why not going straight into schools and going to where the teachers are?
First of all, Jim, thank you for unmuting. I really appreciate that. Second thing is, I think the intermediate units are in a position to know different schools and different school buildings actually have different schedules. And probably the intermediate units are in the best position to understand the scheduling needs of the teachers in each of those school buildings. So the intermediate units are set up for understanding that. They have those connections, and I think they seem to be in the best position to actually make these decisions. And they're close enough to the individual schools so that they have to go out to the schools to make the vaccines, or have teachers, educators come to the intermediate unit. They're centrally located as well. So there are a lot of reasons why the intermediate unit, in this case, made a lot of sense.
And I remember to unmute. Old dogs can learn new tricks.
Congratulations, Jim. That's great.
You said you can't force schools back to in-person, but there was conversation of this, and just to clarify, is the availability of vaccine only being opened or to teachers and staff in schools that are in person?
No. We again, to the extent we have priorities, we've prioritized the youngest, most vulnerable, up to eventually the older students as we go through this process. We have not made any distinction between those that are right now in person or virtual. Again, I'm not sure what sense that would make either, because that changes every week. So what's true right now might not be true next Monday.
So a school that's all virtual would still,
Absolutely.
teachers in a school, okay, thanks.
Yes.
Thank you so much. That is all the time we have today. Thank you to all of our reporters for your questions. We will be putting on a PA cast with this recording later today. Thank you, Governor Wolf. Thank you to all of our speakers, all of our legislators for joining us today. We really appreciate your time and effort to be here in person.
I have one more. Oh, okay. Sorry. Yes.
All right. So thanks, everybody. Have a great day and stay safe.